I see people every day who are struggling with breathing issues. Lots of people with COPD, asthma, and anytime there's a disease that really affects like this life-sustaining function of our body, it comes with a lot of anxiety. So as I worked with a patient this week and we worked through some of that, I thought it might make a good video because I know that there are a lot of elderly people who have COPD. So the woman I was working with had just recently started to have to use oxygen. So it was kind of new for her, and so was this whole struggle with breathing. She was at our facility and then had to go back out to the hospital and be treated and come back. The first time she was with us, I didn't see her at all. When she came back the second time, I was given the job of doing the initial assessment. As I started doing the assessment, I didn't remember that I'd heard that she had some physical issues that really limited her ability to participate. So as we started to talk about COPD, needing oxygen, I asked her specifically if she felt anxious when she couldn't breathe. It's very normal to feel anxious because your brain thinks that you're suffocating. So we talked about that, and you could literally see the relief she was feeling in just talking about it. So we talked about the anxiety that automatically comes when you struggle to breathe. And then we talked about the fact that we actually have a little bit more power than we think we do, and we own a relaxation tool within us. And so even in just being able to calm the anxiety a little, it's going to have a ripple effect at calming our ability to breathe. It seemed like talking about the anxiety helped her to feel better. Understanding how the brain works a little bit and how it feeds our anxiety and how we can use it to calm our anxiety helped some. So we went on in the treatment and we took a couple of walks, and that's when I realized that one of her symptoms that people had talked about earlier is that she couldn't walk very far because she was dizzy. So she'd have to sit down. So as we went for a couple of walks and we came back and we sat down, her sister was visiting her. And when she sat down, her sister said, "You weren't dizzy?" And the patient said, "My dizziness, I think, was related to my anxiety." This person was able to see for herself that she was having an impact on her anxiety, and then she could also learn to control it. So in today's video, we're going to talk about how to present this information to your parent who might be struggling with breathing. And then we'll give just a breathing exercise that you can go over with them. I'm Tammy Provencal. I'm a physical therapist of 20 years, a life coach, and one of the caregivers for my 90-year-old mom. I started this channel to make access to information for caregivers easier, especially caregivers of an aging parent. If you have a parent who's struggling to breathe, in my experience, anybody who has a breathing issue automatically has anxiety. And because of the way that the brain works, it makes perfect sense that they would. When our lungs can't get the amount of air that they need to have, our brain gets that signal and says we're suffocating. It starts to increase our breathing, it starts to tighten our muscles, it starts to increase our heart rate, and all of those things make it even harder to breathe. It's in fight or flight. But through science, we know that we have a way to directly access the part of the brain that's the opposite of fight or flight. So if fight or flight is located in certain parts of the brain, we can use a technique that will call up the other part of the brain that's responsible for rest and digest, relaxation, healing. Once you explain to your parent how the brain works, how the fight or flight and the rest and digest work against each other, and how we can kind of learn to use the rest and digest part to overcome some of the fight or flight, then think about how you can help your parent to feel like they have some control over the situation. One of the biggest things with a breathing issue is not only the anxiety and the trouble breathing, but it's feeling like you have very little control to make it better. So even if we can't control the whole thing, if we can find a little control, it's better than having none. So now maybe talk about the fact that the fight or flight is kind of an automatic thing that happens. The rest and digest, though, we can consciously have some effect on. And once we realize that, then we can use that anytime in the future that we need to calm our fight or flight down. So now you've done some education on how the brain works and how it's not their fault that their brain is going to this fight or flight and leading to anxiety. And then you've told them, but you do have some power over this. You do have some control over this. Now you're going to show them how to use that control. There are many different types of breathing. One of my favorites is just diaphragmatic breathing. It's one of the many ways of breathing that will calm our nervous system, that will calm our fight or flight. Have your parent breathe in through the nose, out through the mouth. The out through the mouth is like you're blowing out candles. So in through the nose, out through the mouth. Just have them do that a couple of times. If you notice that they're breathing very shallow, have them take breaths like a count of 6. So breathe in for 6. Breathe out for 6. Just doing that for 30 seconds, even a minute, is a great way to calm the whole nervous system down, calm the body down. It tells your parent that they have some control. They have a tool they can use in those moments of panic and anxiety that feel so out of control. Thanks for watching today's video. In the comments section, let me know if there are other videos similar to this that might be helpful. Thanks.